Thank you so much, Oklahoma, for joining me today. I wanted to start with a really important message, and it may be repetitive. We talked about it a little bit yesterday, but we have got to increase the testing in the state of Oklahoma. Right now, we have the ability to test 15,000 cases at labs in Oklahoma. That's not counting all of the private labs that we have. So we need all of our state health departments, our hospitals, our mobile labs to loosen those standards. And yesterday we had 9 mobile testing labs set up across the state. We did 500 tests. Tomorrow we'll have 14 labs set up across the state. And just so you can remember, if you have the symptoms of 100.4 fever, cough, shortness of breath, or you've been in contact with someone that's tested positive, you need to get tested. So you can always call 211, or you can go to coronavirus.health.ok.gov to be screened and learn more about where you can go get tested. Today I have Commissioner of Health Gary Cox with us. He'll be giving us an update in a minute. I also filed a new executive order this morning. This unifies our statewide health response. With this order, the state can get workers and money to the front lines of our COVID-19 response as quickly as possible. We are also streamlining operations between our state, our county officials, all the different health departments across our state. It's strengthening our partnerships and our ability to share data and set up more of those mobile testing labs. We are creating additional transparency in our COVID-19 reporting. For example, the state can now notify first responders of addresses where a resident has tested positive. Let me be clear though, the patient's name will stay protected, but it will give first responders the ability to stay safe themselves, also to keep their families safe. Lastly, we are cutting red tape to help Oklahoma's retired licensed health professionals get back on the front lines more quickly. This order does not deploy the National Guard for enforcement purposes. The National Guard is here to help. They are gathering information from our hospitals. They're working with logistics. They're helping deliver medical supplies, PPE all across our state. They're helping me plan for additional medical facilities. Today, I'm also filing an executive order to allow local school districts to continue to pay support staff while their buildings are closed. This is a local decision, and I want to make sure our school boards have the authority to fulfill support staff contracts for the rest of the school year. Earlier this afternoon, I met with the U.S. Corps of Engineers and our National Guard teams. They have been surveying sites all across the state in case we need more capacity for our hospitals. And they gave me an update on all the options that are available, so it was a great meeting. They've inspected a number of facilities in Oklahoma City and Tulsa. I sent them back to also give us some more options from some of the rural areas of the state. And I'll make sure we are prepared to deliver Oklahomans the care they need, no matter the part of the state that they live in or their hometown. My Governor's Solution Task Force is working this information into a comprehensive hospital surge plan, along with our hospital association. They're working on their surge plans as we speak to find the most effective solution for the care of Oklahomans. And my last message before I turn it over to Mr. Cox is directly to Oklahomans. We are going to get through this. We are going to get through this. I know it is difficult on a lot of our families. There's people that have lost their jobs. There's people that are dealing with loved ones that are sick right now. There's small businesses that have had to close. But we really have to take this seriously over the next month. So that's why I've extended my executive orders till April 30th. And it's up to all of us. It's about personal responsibility, the social distancing that we need to continue on to really flatten this curve. So the next 3 weeks are going to be critical. Thank you, Oklahoma, for taking it seriously and continuing the social distancing. So, Dr. Cox, Mr. Cox, will you give us an update?
Yeah, thank you, Governor. The events that we're facing with COVID-19 in Oklahoma are unprecedented. We haven't seen anything like this in the last 75 years plus. And so while fighting this virus is unprecedented, Oklahomans coming together in a united front is not unprecedented, and it's become the Oklahoma standard. As a former health director of both Metro Health Departments in Tulsa and Oklahoma City, I think we just want to give a shout out to them for the valuable partnership that we've had in coming together, and they're doing great work in Tulsa and in Oklahoma City. I'm also proud of our 68 county health departments around the state. They're doing wonderful work. They're working day and night, 7 days a week, and they're testing and screening and helping people, giving information. And so with the governor's strong actions today in issuing his orders, we can continue to come together as a state. And it's going to allow many things that the governor alluded to. For example, allowing counties and county health departments to operate together within a district, to share resources, to cut administrative costs, and cutting red tape so that we can be more efficient. Working closer with our first responders and others in the community, as the governor mentioned. It allows us the opportunity to take quick action for important life-saving equipment, for example, obtaining ventilators from surgical centers if that would be required. To share, it's important, and we know that a lot of people and a lot of Oklahomans want more information. And so we want to share more localized information at the county level, at the city level, so that families and individuals have the information that they need to protect themselves and their families. So we want more county and city-specific outbreak information. We also want to have greater transparency in releasing information about outbreaks in nursing homes, long-term care facilities, and so we will be releasing that information very soon. We're also working very closely with the Department of Mental Health and Substance Abuse, and we're going to deploy across the state MyCare technology resources beginning next week at all of our 68 county health departments. This will allow us to basically have telehealth for mental health, and so we will have these available so that individuals can get mental health services, behavioral health services that they might have in this time of challenge that we are working with. These actions and many others are about reducing the demand on our health care system. That's really what it's boiled down to, so that the system will not be overwhelmed. And it's all about providing the necessary hospital beds and having those available, the protective equipment for the medical workers, and about actually medical personnel to take care of the increased demand that we will see. And so it's all about what we can do as Oklahomans. Each of us have an opportunity to be part of the solution, and how we can be part of that solution to keep the demand down for the medical system is simply to not congregate, to keep a safe distance, 6 feet or more among people, and to stay home. And this will reduce the demand, except where necessary to get out according to the governor's executive orders previously. This will reduce the demand on our medical system. It'll keep more people safe and more people healthy.
So we'll open it up to a few questions.
Trey Savage, non-doc.
Hey, thank you, Bailey. Thank you, Governor, for your time today. Commissioner Cox, Secretary Lawridge. Governor, one of the Title 63 statutes activated by your health emergency declaration today will be the suspension of the provisions of any regulatory statute or administrative rule that I guess gets in the way of dealing with this health emergency. With that said, can you give us other examples of those things that need to be suspended? And are you willing to make a commitment today to alert legislators, media, and the public anytime a law or a rule is suspended in this manner? And since we can't ask follow-ups, I want to be clear. The question is, are you willing to make a commitment today to alert people anytime one of these laws or rules is suspended? Thank you.
So thanks, Trey, for that question. And absolutely, this is we want to be transparent, so we will let you know, the media know if there's any rules that are suspended. This is really a unprecedented time, and it's the ability for our state to coordinate. We cannot allow different parts of the state planning surge hospitals. We've got to have a unified response. We're seeing the modeling. This is a statewide response. That was the reason that this is in our Constitution and gives us the authority to do this. Also, with some of those HIPAA laws, we want to protect our first responders. That was another reason for doing this. But mostly, this allows our state to have a comprehensive plan for the peaks that we're seeing in the modeling, and that's why we had to do this.
Randy, Tulsa World.
Governor, you touched on this, but I guess some people are still concerned about the National Guard. So can you tell me exactly who has been activated and maybe go into a little bit more detail on what they are doing and what they're not doing?
Sure, absolutely. So we have 29 National Guards called up. And the reason I called them up is we needed to gather information from all of our hospitals. We needed to get logistics down. We needed to deliver supplies out to our hospitals. So every single day at 5 o'clock, I'll be leaving this press conference and going into our daily briefing. The National Guard is the one that puts that together for us. So they are here gathering the information. They're here planning for the hospital surges. They call the hospitals, all 81 hospitals, every single day to track PPE equipment. So we are granularly getting down to the detail on gloves, masks, N95 masks, gowns. We know that our statewide average is over 11 days. And then we track our strategic supply as well. We've been ordering, I think we have 1.2 million N95 masks on order right now. So those are all the things I have the National Guard doing at this point. If there's another future mission, for example, with our meeting with the Corps of Engineers, the National Guard was part of that meeting. If we do execute on, alternative care facilities or field hospitals, then they will most likely be part of that mission as well. And I'll let the public know when we call them up. But right now, it's 29 guardsmen that National Guards that are up, and they're working here basically on data collecting and logistics.
Erica Stanish, Fox 25.
Yes, Governor, I just had a quick question. You were talking about those field hospitals. Do we have any idea on how soon we could have those set up and ready to go if we needed them? I know one of the models show Oklahoma's peak could be April 22nd. Do you expect to have them set up before then?
Yeah, I'm going to let Secretary Lockridge take that. He's been, we've tasked him with doing that modeling and focus on the hospital. So, Secretary?
Sure. Thank you for the question. And working together with my colleague on the cabinet, Dr. Casey Schrum, and with the absolute exceptional assistance of the Oklahoma Hospital Association, we're well underway to planning what the surge would look like between and among our existing network of hospitals in the state. That's our first line of defense. And what the hospitals have provided over the last few days is what it would look like for them to flex up 40% of their normal capacity. Now, beyond that 40% surge enters the help of folks like the National Guard and the Corps of Engineers. Those operations can be spun up relatively quickly. So think in a matter of weeks, and certainly in time for us to meet what would be the height of our surge. But I think importantly, it is when does the first onset occur when we need capacity? And I think that will be accommodated well with the planning we're doing in conjunction with our hospitals.
Brian Dorman, News on 6.
Mr. Governor, thank you for taking our question. Even after you updated your safer at home order, many are still calling for a statewide shelter in place. If you look at states like California and New York, people can still go get takeout from their favorite restaurant and go work an essential job. How is that any different from what you've put in place?
You said it very well. It's not a lot different. You know, the safer at home policy that we have statewide really focuses on the vulnerable population. 70% of the deaths that have occurred in Oklahoma have been those over 65. The 9 folks under 65 that have passed away all had underlying health conditions, heart disease, diabetes. And so that was what the order was for. When we closed all non-essential businesses in all 77 counties, that practically did the same thing that most other states have done. So when you look at what's actually happening on the ground, we are very similar to most states. We are tracking that. I know exactly what the other states are doing, but we're making the right decisions based on the facts in Oklahoma. And Oklahomans, as a general rule, are doing a fantastic job. I mean, our businesses are taking this very seriously. We are working from home. We're spreading out. But ultimately, this comes down to personal responsibility. And I said it yesterday. We know that our folks have to go out to the grocery store. They have to go to the pharmacy. It's about being safe when you're there, washing your hands. It is about staying away from gatherings of 10 or more. That's been an executive order of mine since early March. And so I just want to implore Oklahomans, we have to continue on this path for the next 3 weeks, for the next month, until April 30th. This is when we feel like that we're going to get on the other side of this. That's our hope. And I'll be looking at the data daily, and I'll let Oklahomans know if we need to take any other action, but we are doing what we need to do at this time.
Dylan Richards, KOCO.
Hey, Governor, you mentioned in the executive order streamlining the response between state and county health officials. What exactly does that mean in terms of local health departments versus the state health departments? What exactly does that mean?
Gary?
Sure. Well, I think that just means all of us continuing to work together collaboratively as one system, moving in lockstep as far as integrating our goals and our operations to do the things that are most likely to protect the health of the people of Oklahoma. So working together, we've been working together, but continue to work together even more closely.
Paul Moniz, Oklahoma Watch.
Thank you, Governor. I appreciate this time. This is probably a question more for Secretary Lockridge on the Army Corps of Engineers hospitals. Who would staff those hospitals if they were needed? Would the federal government provide the staffing for that, or would there be other state staffing needs that would we need to put on that hospital system there?
Sure. Thank you, Paul. Clearly, staffing is essential. A bed alone doesn't help a person get better. This is where our nurses, our physicians, and our allied health professionals come into play. That 40% surge that I referred to among and between our hospitals will be staffed by existing folks that are within our system. When we get beyond that, then we do enter the realm of more creativity, and so it's possible that some folks can be pulled in from federal sources, to be sure. Others have done that, and here you can think about corps of medical personnel for sure. But also, I think Oklahomans are thinking creatively about, as the governor alluded to earlier, bringing folks who may be retired from their profession in. We have now relaxed some of the strictures relative to licensure that may have gone out because of retirement. This is the sort of creative approach that we're going to take to staffing what could be, a very large surge. Again, though, the first line of defense in terms of our surge capacity are making sure that we appropriately distribute the existing medical professionals that are in our communities, and that work is well underway.
Chris Castile, Oklahoman.
Hi, Governor or Commissioner. I was wondering, what kind of demand has there been at these mobile sites, these drive-through sites for testing? I understand the site in Pottawatomie County had very few people there today. There are a lot of workers standing around waiting for, but I was also wondering too, do you foresee a time when anybody that wants a test can go get one? Whether they've got a temperature or not, or was around somebody that had that tested positive?
Sure. Well, I think as far as the demand for testing, as the governor mentioned, overall about 500 tests across the state of Oklahoma today. I understand that in some of the areas, the demand has not been as strong. We try to get the word out on social media and other ways of getting the message out. We'll continue to get that message out to folks in a number of ways through the local media and others. But we want to continue to push messages out to get more people out that need to be tested. And so we'll continue to work on that.
And I would add one thing to that, Chris. I was down in Norman today and was with IMMY, IMMY, which is a commercial lab, and they have their testing up and running now. So they did a fantastic job. Great company down in Norman. They are also working on an antibody test. That is a test that will tell if you've already had COVID-19, and so we want to start developing that test as well. We want to get that out to the people across the state to start showing that more people have already had it. That's going to drive more testing, that's going to drive more modeling, and that's going to let us know when we can actually get started back into work if you've already been exposed to it or you already have an immunity to it. So that antibody test is something that also most states, I really believe we're going to be a leader in that in the nation, and I want to start getting that out across Oklahoma as well.
Tiffany, Fox 23.
Hi there. Thanks so much for taking time to update us this afternoon. I had two questions, one for Secretary Loffridge and one for Commissioner Cox. First, for Secretary Loffridge, I know that you had explained sort of so that we could share with our viewers how the PPE supply from the state works and how it's used and primarily will be used during the state's surge and during that true emergency peak time. Yesterday, we know, and this morning, Governor Stitt shared with us that you all are also closely monitoring the rural first responders, which is great, so that they can continue to stay, have the PPE that they need. What is the situation? Are you all now going to start giving some of that PPE out or just as needed, or are you still mostly holding some of it for the peak? That's for you, Secretary Loffridge, Loffridge. And then also for you, Commissioner Cox, you just answered Dylan's question about staying in lockstep with Tulsa County and Oklahoma County Health Department. So we know that Tulsa County shared with us yesterday a range of anywhere from 175,000 to 350,000 coronavirus cases and a death number between 2,000 and 3,100 by August, those numbers. So what are you forecasting for us here in Oklahoma, short-term and long-term, and best case and worst case scenarios?
Sure. Thank you for the question. I believe it was, what is the process by which we distribute PPE, personal protective equipment? So the way this works is each of our individual hospitals, our medical systems have their own supply chains, and they're actively buying on an ongoing basis. Really what we have at the state, where we manage the Strategic National Stockpile, the SNS, is that source of last resort for when hospitals start to run low. Now, as it stands now, in that stockpile, we have, we're running on a comfortable 11 or 12 day supply. What we monitor on a daily basis from hospitals is what they have on hand, and we literally have, red, green, and yellow in terms of individual systems. And what that allows us to do is to hear directly from hospitals in real time when they reach difficult positions. When they do, we supplement with the stocks we have. But as we stand right now, and we'll be briefing the governor on our daily status in just a few minutes, we have mostly green across the board. Again, as I've reiterated, that varies from location to location. The numbers we provide of 11 days or so of PPE on hand are averages, but to date, the way this has worked is when a hospital or other institution expresses that they're heading into the red zone, we're able to swiftly deploy equipment and to get it to them. I would also add that we have already released to these first responding groups that the governor has referred to. These are critical support personnel for this effort. And now we have, as of yesterday, been able to release to all counties PPE that will help our first responders to keep them safe as they respond to critical issues.
Thank you for the question. I know there are three models that, in addition to Tulsa's model, that are being looked at that we're aware of in the state. And then, of course, there are national models as well. And so usually they're given in a range of low mitigation, medium mitigation, or high mitigation. In other words, how much action do you take, preventive action do you take as individuals? And of course, all these models are, they're all built on assumptions, and so the how good the model is depends on the assumptions and the information that you put in them. And of course, they're changed and updated. We have three of our groups that have done the modeling: the University of Oklahoma, Oklahoma State University, and the State Health Department, Dr. Wendelbo's model. I don't have those actual numbers right in front of me, but I'm happy to get you that information.
That'll be all for today. Has to get to a briefing. Thank you, everybody.